My name is Robert Stauffer. I'm one of the interventional cardiologists here in Fayetteville. I work at the Washington Regional Cardiovascular Clinic, which is part of the Walker Heart Institute. Heart palpitations are, generally speaking, when the heart feels like it's racing and it is perceived by the patient that the heart is going fast. It may not be, but that there's still the perception of that. Sometimes it's extra beats where there's pauses and the extra beats are a little hard beat, or flip-flopping is a common word we hear. There are several things that could contribute to palpitations. It can be allergy medications, particularly inhalers. It can be ADHD medications, which are stimulants. It can be diet pills, which some of them are stimulants. It can be hyperthyroidism, which is another common cause. It can be underlying structural heart problems that are more serious that need to be investigated. So you have to kind of figure out whether there's really an underlying structural heart problem versus whether this is just garden variety palpitations, which are by far the most common. There are certain things to watch for that are more serious when you have palpitations, and that would be if you're passing out, if you're having what we call syncope, where you're no warning passing out. That's always a big concern. If it feels like the heart's just racing away with itself and it doesn't stop, and associated symptoms, chest pain, shortness of breath, other things like that. Well, I think if you come to see us, there's several questions we're going to ask you if you are having palpitations. One is, do you have thyroid disease? Have you had your thyroid checked? What medications are you on? Have you tried to wean down the dose if you're on certain medications that might be causing that? How much caffeine do you drink? And other stimulants you might use? Do you have any family history of heart disease at a young age, if you're a younger person? And then what other associated symptoms you have? It's a fairly simple workup to find out if there's an issue. A lot of times you'll wear a monitor and possibly to get an ultrasound of your heart so we can get an idea, is there a problem with the heart itself, and what are your palpitations? I think you should ask some of your questions so your regular doctor can work up a lot of this stuff without having to see a cardiologist, but if things are serious, then you need to come and see us.